tukiwa naongelea preventive measure, specifically primary prevention, tukibase sana sana kwenye shule, tena hasa primary school, wakifundishwa, wanavozidi kukua na kujengea yale mazingira, ndio itakuwa tabia yao. Ila kuliko interventions zinazokuja sasa hivi inakuwa na impact ndogo. Na hata ukiangalia zile ripoti zinazoonyesha prevalence inapungua kwa kiasi kidogo. Ila haiwi effective sana kuliko ukimfundisha mtu toka mdogo. Mfano mzuri ni kwenye dini. Yes, ukimjengea mtoto mdogo anakuambia ukimfundisha kama ni Muslim au kama ni Mkristo, ukimjenga kwenye dini kutoka mtoto, kile kitu atakishika mpaka atakapofika ukubwani. I think nimemaliza.
Dr. Asitu was simply telling us that mlee mtoto katika njia impasayo na hata iacha hata uzee. Dr. Hosea will shortly take us through the next session, that is nutrition programs in Tanzania. Please, a hand of applause for him.
Good afternoon. Nutritional programs. For sure, I have to change the modality of the presentation, therefore. Nutritional programs. So for sure, I have to change the modality of the presentation, though. I have to call upon everyone's attention so that we can move together. So as he is preparing my presentation, I have to go through what I have prepared for this gathering today. Today is the special day to present the nutritional programs in Tanzania, and not just the nutritional programs in Tanzania that are implemented by the Ministry of Health and Welfare. As we start with an overview of what is nutrition, as the first presenters they have tried to present, we say it's just acquiring nutrients, and not just nutrients. It is either micronutrients or macronutrients. But when we go to the overview of what is malnutrition, we always speak of either undertaking or overtaking. So when we speak of undertaking, is what has been mentioned by the previous presenters, speaking of wasting, speaking of stunting, speaking of low birth weight, speaking of iodine deficiencies, but iron including anemia. Therefore, going to the basics that I have prepared for you today, we have several nutritional programs that are implemented in our country. But for us today, I have to get you into just 6 nutritional programs. The first nutritional program that is implemented in our country is the Iringa Nutritional Program. The second one is the Food Fortification Program. The third one is the Universal Iodization Program. The fourth one is the Agriculture Sector Development Program. The fifth one is the Water Sector Development Program. And the final one, is my presentation was guiding, is the Vitamin A Supplementation Program. So Mr. Asitu has helped me to mention at least 2 programs. So those programs are also part of the presentation, though we can go quickly. So as I tried to mention, starting with the Iringa Nutritional Program is one of the common nutritional programs that was implemented since 1990. And this one was implemented in Iringa region, focusing 168 villages, covering a total number of people, which was 46,000 people. And of course, it excelled much, and with a lot of success. And of course, I will pass you through. But going to the Food Fortification Program, this also the program that was started in 1984. And it excelled much with the focus of making sure that the food fortification is enacted into wheat, maize flour, and other foodstuffs that would make sure that we improve nutrition status of our people in our country. But going into the Universal Iodization Program, speaking of the Universal Iodization Program, it's the program that is very important, and it is having a lot of success. I will show you the percent at least, but with the iodization, the focus is to reduce at least the number of people whom are lacking into their nutrient, are lacking at least the iodine, and making them stunting with some other stuffs that are lacking from iodization of salts. Therefore, empowering the salty producers so that they can make sure that within salty, primary salty producers are including iodine into the nutrition, so that to pull up and remove the burden of getting malnutrition in our country. But going to the water sector nutritional program. Ladies and gentlemen, we have got no good nutrition if the water is not safe. Therefore, one of the burden that three groups, speaking of infants, speaking of children less than 5 years old, but speaking of women who are at the reproductive age, they are learning into diarrhea. This is just because of unsafe water. So with the safe water, we make sure that we improve. So with this water sector development program, we are sure with its excellence and success, it has improved a lot toward the nutrition status of people. But going to the other agriculture sector development program, this has been divided into two phases. But the last phase lasted in 2014. And the second phase was launched by President Magufuli, Dr. John Pombe Joseph Magufuli, just here at Julius Nyerere International Convention Center. And this one was in 2014. And this one, the phase 2, it takes a time of 10 years. And the first phase has started in 2014, and it will last in 2023. But the second one will begin there and last in 2028. But the essence behind is making sure that the agriculture is improved, making sure that the livestock crops are well equipped so that we can improve the health status of our people in our country. But speaking of the last program, which is the vitamin A supplementation, sometimes this one is linked with what we call the deworming program, which of course focuses to infants starting 6 to 59 months, making sure that we improve the health status of these young children and make the healthy nation in our future. For sure, we have challenges. In every success, we have challenges. The challenges over here are several challenges. A lot of challenges are there. But we have 3 main challenges that I have tried to mention with you. At least you can understand and know what to do as we close the forum. The first challenge is the coverage of these programs. Some areas are remote. It's hard to reach there. Therefore, with the poor infrastructure and so forth, so the implementation of the programs gets harder. But the other challenge is there are fewer facilities, healthy facilities, that are having a complete set of what we should do about reducing the burden of malnutrition, speaking of these 3 groups that I have mentioned. But finally, speaking of how do these people link, how do these private organizations link so that they can implement and reduce the burden of what we call malnutrition in our country or in our people. Therefore, the recommendation is making sure that our people are safe by making sure these programs are strengthened as we discussed today. So these are the programs that I have tried to mention and go quickly so that we can save time. This is the Iringa Nutritional Program, the Food Fortification Program, a Universal Salt Iodization Program, and we have the water sector development program, and we have the agriculture sector development program phase 2, as I explained prior, but we have the vitamin A supplementation program, plus those two that he has mentioned. Thank you a lot. Thank you for your attention. Thank you, thank you, thank you.
Thank you very much, Dr. Hosea. Dr. Ikanisia Kawiche, you're welcome. Can you please clap hands for her?
Good afternoon, everyone. As I was introduced earlier, my name is Ikanisia Kawiche, a student at St. Joseph University, and I'll be walking you through about nutrition in schools, mostly primary schools and a touch of secondary schools. So I'll begin by telling you a very small quote that says, "You cannot teach an old dog new tricks," and in this sense, it means that we are the old dogs and the new tricks is health, because right now health is the most challenging thing in many adults, in many youth. We are all trying to do different kind of things. We are all trying to exercise, trying to find healthy meals, healthy diets, and it's not because that health is a new thing, not exactly. It has always been there, but we haven't been growing into practicing and participating in healthy habits. And why is that so? Because as children, we weren't given that foundation, and so it is coming as a new knowledge that we are forced to participate and practice. So it's like we are the dogs, old dogs, and we have been taught new tricks. So by carrying on my presentation, as I've said earlier, it's that good nutrition leads to good health, and good health also makes us be able to acquire good education. So, and how are we able to do all this? Excuse me. So why is it important in teaching and educating the youth or the young or the children about health? It's because it's increased in nutrient intakes, it gives us better health outcomes, it also improves higher performances on tests, it improves grades, it also brings low instances of absenteeism. And how are we going to do this so as it doesn't become another boring subject at school or at our at our education settings? Firstly, in our classrooms, then other ones will be doing farm to school, then school gardens, then in cafeterias. How are we going to do this in the classrooms? First, we all like an interesting learning environment, so we are going to begin mostly in primary school students or the ones in nursery by showing them counting with pictures of fruits and vegetables. As we all know, kids are very curious at trying new things, so when we introduce them to this scope of nutrition and health, they'll be interested. They'll be curious to want to try the fruits that are being taught at schools, the vegetables. Also, by learning fractions, by measuring ingredients for a recipe, examining how plants grow, learning about cultural, traditional foods, because as I said earlier, kids are curious. So also farm to school. And how are we going to do this? By introducing farming activities at schools. As we all know, some secondary schools are practicing this. Mostly the school that I've studied at my O-level used to farm a lot, and it's Kibosho girls, by the way. So by doing that, we become interested and we become curious about, okay, I'm farming maybe about maize. What is it about? I'm becoming interested, and I'll practice more and more on how the food, the nutrients, and everything. And also about gardens. The more you involve kids in doing things, the more they'll become curious, the more they want to learn, and the more they will use that knowledge even in their adult life, and we are going to have a healthy generation. How are we going to do this in the cafeterias? Firstly, by introducing new meal programs, see what balanced diet meals look like, and may be encouraged to try new foods through verbal prompts from school nutrition staffs or tastes. And why are all these methods so important, and how are we going to do this more? We are going to do this more by lectures and demonstrations, workshops, films and slideshows, posters, charts and exhibition, books, pamphlets, bulletins, radios, and television. With all these methods and all these kind of improvements that are being taught, or we are all trying to make people learn, there are also limitations. Why? Because firstly, we require specific skills. We also lack resources, and they remain ineffective if causes are not identified. Conclusively, good nutrition habits and a balanced diet aren't developed in one day, nor are they destroyed in one unbalanced meal. Nutrition education is an important element in an overall strategy aimed at improving food security and preventing all forms of malnutrition. So it should be taken into account to our government agencies, NGOs, schools, colleges, universities, to share the knowledge about foods and their nutrients to common people, students, pregnant women, etc., to improve their health, eating habits. Also, they can share to their families, friends, and new ones. If we don't all do this, health is going to be the new wealth. Thank you for listening.
Thank you very much, all presenters. And with the 7 minutes remaining, I welcome any question or comment from the House. Okay, can start from behind.
Good evening. Thank you so much, and I would like to congratulate all the presenters. And I was kind of very much impressed and touched with the discussion. My first comment, I don't think if it is a comment or what, but it would sound very good if this session would have been nutrition problems in Tanzania and not nutrition disorders in Tanzania. If we talk about disorders, it's another topic. So I will focus on nutrition problems in Tanzania. The first comment also goes to Dr. Chaka. When you studied your presentations, you displayed a certain picture. So I was kind of amazed as on what kind of information that picture was trying to communicate with us, because it was like picture a burger, pizza, chipsy, and everything. But the title was contrary communicating with the picture. So next time if you prepare the presentation concerning nutrition, try to put the picture of more nutritious food more than the junk food that you have presented. Because nutrition is more of behavior. So if we see those kind of foods, we may think that those are the more nutritious food more than others. That is just a comment. Okay, so moving to the presentations. Now, Tanzania, we are implementing the National Multi-Sectoral Nutrition Action Plan, which describes the key nutrition activities, I would say, vipaumbele vya lishe vya serikali. And actually, the action plan that we're implementing now is the action plan number 2, after the finishing of the action plan number 1, which phased out on 2021. Now, in that plan, if you go through it very deeply, and of course I will suggest that you go and read it, it specifies how Tanzania is going to go about the key nutrition problems in Tanzania. And the main focus is on the nutrition in the life cycle. I know you believe that if we invest in children, even it will be more successful. When we focus more on training children on the nutrition issues, it will be more successful. But at the world it goes, and the most of the changes that are happening right now, nutrition education should go through the life cycle. As in, you will deal with children, we'll provide the nutrition education to school-age children, but now we have the nutrition interventions that focus on adolescents. But now with the emerging issue of overweight and obesity among children, among women with the childbearing age, now we should have the intervention that focus more on women of that age, and we should also have intervention that focus even on elderly. So now we focus on the nutrition in the life cycle, that we train all groups of people. We have intervention for all people at every age, and that is like a cycle. So we should not focus more on children. We know that is the coming generation, but we have the intervention for all people from the childhood to elderly. And also, Dr. Chaka Chaka mentioned about the using of cultural events as the forum to provide the nutrition education. So I just want to give you the information. Now the government is working on the Village Health and the Nutrition Days guideline. And that is the forum that have been thought by the government as the very best forum to meet people from the community. And they have the forum where the community will learn and discuss on their own nutrition problems and come up with the strategies on how are they going to combat their problems. So the Village Health and Nutrition Days, it can be at the cultural events, but it's something that are supposed to be conducted at the village level, where the village themselves decide on what kind of interventions are they going to do as the part of themselves learning on how to combat several nutrition problems that they have. So we have that problem, that forum, and the government is working on it. And it is a mandatory for every village to make sure that it conducts this Village Health and the Nutrition Day. So that one is covered. The one who was talking about the nutrition programs, we thank you so much for giving us that nutrition programs, but I just want to let you know now, as the National Multisectoral Nutrition Action Plan is being implemented, we are no longer working with the programs. As in, we don't have the programs. We have a number of nutritional interventions as have been stipulated into the plan, and they are implemented all over Tanzania. We know we had the problem of the coverage on the previous years because most of the intervention were being carried as the programs, that this is the Fortification program, this is the vitamin A supplementation programs, but now we are not dealing them with the programs. They are being conducted in all districts and regions in Tanzania. And to reduce the challenges of coverage, to reduce the government of, the challenge of the coverage, now the government has a number of strategies that have been put into place to make sure that we reduce the challenges of poor coverage of the nutrition programs. Now we have nutritionists in every councils in the country, and we have guidelines that guides the nutritionists on what kind of intervention they are supposed to do. And we are even having the strategies of making sure that we have funds to implement the nutrition program, the nutrition activities in those councils. So we are no longer moving as programs, but we are just implementing the action plan, the Nutrition Multisectoral Nutrition Action Plan, and it is conducted in every part of Tanzania. So we don't have programs anymore, just to make the environment clear. I'm finalizing, of course. To Dr. Kawiche, your main focus was in how to deal with students. That one is very well captured in Tanzania as improvement. We are having school nutrition programs where all schools have been directed to establish nutritional clubs. If you remember, when you were in the secondary school, we are used to having clubs. We have AIDS clubs, malaria clubs, sanitation clubs. Now we are having nutrition clubs, which will be a good forum for the students to learn on various nutrition issues, such as creating vegetable gardens, on how to prepare food, what kind of food they should eat according to their age, and something like that. So we have those school clubs as an intervention, But we also have an IEA program which is being run. Of course, the IEA program is the overall program that is dealing with adolescents, but among with, we have intervention that focuses on adolescents nutrition. But also we have the school feeding or the school meal intervention, where the main focus to make sure that children eat at school, but they do not just eat food, but there is directive that are being given to school that children has to eat the fortified food just to make sure that they eat food that is okay. So as the government, there's a number of interventions that we are doing, and we are very delighted that your forum brought up the matter. But in final,
So during the study,
I would like to
number of
advise the universities maybe to update their
0 to 9 to the
final to advise the universities, the St. Joseph University and other universities, just to update their curriculum so that they can fit with the updates on the nutrition that is happening on the universe. Because what I remember when we are dealing with, where we are studying nutrition, the only problem in Tanzania were undernutrition. But as we go, now we have the problem of overnutrition. And as we go now, there is an emerging problem of the food safety. We have the issue of antimicrobial resistance. We have issues of aflatoxin and everything. So every day there are updates. So I think people who are working with the universities, they could see how are they going to incorporate those updates on their university's curriculum so that our students will be more updated on what exactly is happening on the universe. Thank you. Very sorry for taking much of your time.
Thank you very much. And we are actually out of time. And thank you very much for the enriching infos that you have updated us with. We really appreciate, and for the interest of time, we would like to call it a session for today. Please, a hand of applause for the team. Thank you very much.
Thank you so much. As they are coming, we can put another round of applause for them. We are getting ready for another session from P.O. Raj, so just get seated. We are going to start soon.
Where